Hi everybody. Bonjour tout le monde. How are you doing? How's your family doing in these strange and surreal times that we're in? At Community to Community, we have friends and family and neighbors, and of course, our partner communities in Petit Goâve, Haiti, whom we miss and are praying for and hope that we can see them soon, face to face, when we overcome this coronavirus. We are encouraged by what is happening here at home and on the ground, that soon we will be able to see each other face to face. As challenging as it is here in New York and across the US, in countries like Haiti, who already had a weakened health system, this pandemic only makes it weaker. There are some things that we do share. The search for protective gear, masks, gloves, ventilators. Reports show that there is approximately 64 ventilators and one working hospital in the entire country of 11 million people. That is equal to the total number of people in New York. So you can see why we are concerned about the people we serve in Petit Goâve. Across the country, most people receive their health care from small nonprofit organizations like Community to Community. And while there is protocol in place for washing hands, staying sheltered in place, and keeping your social distance, you can imagine how challenging it is when someone tells you to wash your hands, but you don't have access to clean water, or to shelter in place, but you don't have a place. And if you have a place, you may not have electricity. Or to keep your social distance when the place that you stay in may be a closed-quartered space. And where you work may also be a closed-quartered space, and you have to go to work in order to make money to pay your bills and feed your family. With the number of COVID cases rising daily, C2C feels like we've been preparing for this with everything we've had to overcome, every challenge over the last 10 years. Here's our plan. Educate and equip. This served us very well in 2010 when we responded to the cholera outbreak after the earthquake. In 2017, our C2C neighbors helped launch our continuous care initiative to address the health and wellness needs of our Mountainside partner community. This service entailed a monthly visit by our in-country doctors who provided consistent health care for the community's specific needs. In 2018, our Mountainside partner community put on the continuous care initiative themselves. We did not have a pandemic in mind when we created the Continuous Care Initiative, but it is through this initiative that we will respond to COVID-19. Our medical personnel on the ground and our Peasant Association are our front line. Supporting them is paramount. We worked together and collaborated to create a coronavirus training presentation and a coronavirus protocol flyer. Our doctors on the ground are presenting that training to our Peasant Association, who then will in turn educate and equip their communities. The more people are educated, the more people are equipped with this information, the more we hope to slow the spread. The circumstances have changed, but our mission has not. Creating self-sufficient communities by working with the community. The presence of C2C New York is not required for our Peasant Associations to mobilize and respond to this pandemic. What they need are supplies and support. The C2C Haiti and New York teams have met and devised our plan. This plan will ensure that the front line has the resources and tools they need to provide safe, effective care and treatment for our communities. Starting this month, we will launch our C2C Collaborative COVID-19 Response Campaign. Our goal? To raise $40,000 to secure supplies, materials, and everything that our partner communities and our medical team will need to respond to this pandemic. I'll admit, when people everywhere are dealing with this coronavirus pandemic, it's hard to ask for donations. But as you can see, we are not asking for ourselves. Check out our plan below. I hope that it will inspire you and encourage you to support us and our partner communities. As always, the amount that you give is your choice, because every little bit helps and will make a big difference. So, stay home, slow the spread, and save lives, here and in Haiti. On behalf of the entire C2C team and the people we serve in Petit Goâve, thank you very much. Merci en pile, and may God bless you. Te bon Dieu béni.